want to take in with us. We've got early rescue trolleys available. We've got drugs for intubation, sedation, and iron troops if we need them.
Intubation of a patient with COVID-19 is considered an aerosol generating procedure. Therefore, all members on the team should be fully donned in PPE. Ideally, the patient should be managed in a side room with negative pressure, and prior to entering the patient room, the team should huddle and run through the outside checklist. Key topics to cover during the huddle are team role allocation, checking of kit and drugs, airway management planning, and correct donning of PPE using a buddy system.
So let's start running through our pre-intubation checklist. Okay, so start pre-oxygenation. Let's go.
Once in the room, staff adopt the positions that are appropriate to their role, and the intubation checklist is commenced. Important points to note in the intubation checklist include role allocation, equipment checking, and a run-through of drugs that are going to be used. The plan for a failed intubation should also be discussed prior to commencing the intubation. A key principle is that bag mask ventilation should be avoided. Staff reading this list should state the items on the list clearly in order that all members of the team can hear and understand the plan. Communication is more challenging whilst donned in full PPE. Airway rescue equipment should be readily available, and the second nurse will be available to bring this into the room if required. Please note that this nurse is considered contaminated if they enter the room at any point during an aerosol generating procedure. Following administration of a muscle relaxant agent, wait for 45 seconds prior to attempting intubation. During this time, you should avoid bag mask ventilation if possible, and ensure a good seal between the face mask and the patient's face to reduce the risk of aerosolization. After 45 seconds has elapsed, perform laryngoscopy using a disposable laryngoscope or videoscope if available. Once the ET tube is successfully inserted, ensure the pilot balloon is inflated prior to providing any positive pressure ventilation. The ET tube should be connected to the ventilator circuit as shown. Positive pressure ventilation using the ICU ventilator can now be commenced. Confirm ET tube position by confirming a capnography trace. Once the ET tube position is confirmed, refer to the intubation checklist again and discuss lung protective ventilation and the post-intubation checklist, which includes commencing sedation, assessing hemodynamics, and considering the need for insertion of an NG tube, central venous access device, and urinary catheter. Once this checklist is completed, staff should prepare to exit the room for doffing of PPE equipment.
Okay, so exit checks. Anyone notice any PPE issues?
Yep.
Kit issues and decontamination? Don't think we have any problems, did we? Intubation sticker will put in the notes, chest x-ray will order. Any points to debrief or any learning issues? Great, we'll restart the trolley.